a tough year for all of us, and hope all of you stay safe and healthy. We try. Hi, Alan first. Very happy to have you. We should have Dr. Hani Hassan introduce to us the topic of publishing during the pandemic. Unfortunately, Dr. Hani catch COVID a few days later. Yes, and he's getting well. He's in home isolation, and he will give the next lecture. I'm so happy that Dr. Allen will be able to talk with us about the publishing during pandemic. Dr. Allen, can we publish during the pandemic?
Oh, absolutely. And thank you very much, Dr. Hussain, and all friends at Asyut. Congratulations on this wonderful meeting, even during these difficult times. And of course, our sincerest thoughts go to Dr. Hani. I hope he gets well very soon. So anyway, back to the question, can we publish during the COVID-19 pandemic? And the answer, simple answer, is yes. You can stop listening now, and you can go and write your papers. But if you want some more information, let's get into this little topic in a little bit more. The trick is, though, publishing during this pandemic is the same whether you're publishing at any other time. I don't think the basic rules have changed. And there are many things we can talk about, but let's just narrow it down to 3 things I think I, as an editor, and you know I'm an editor of EJCTS and the Asian Annals, there are 3 things that I, as an editor, pay most attention to when deciding whether to accept or reject papers. And that's the quality, the message you're trying to convey in your paper, and some intangible elements. In terms of quality, there are 2 different types of quality. There's quality of the science and the quality of the writing. On each of these things, we could talk for a whole day about these things and not finish. So I'll just make it really, really condensed for you today. In terms of the quality of science, one way to look at it is the pyramid of evidence. Papers that are at the bottom of this pyramid obviously are poorer quality of science. They don't really give you that much information, and therefore for the journals they're not going to get many citations, and so therefore journals tend not to favor these. What journals love are the ones at the top, the meta-analyses and the systematic reviews, because these statistics have shown that these papers get cited the most, so it helps the journal's impact factor. But on top of these are guidelines. If journals can publish guidelines, so if, for example, Asyut or the Egyptian Society has some official guidelines, a lot of journals love these things. What journals hate are surgical technique papers and case reports because they never get citations. So this is a very simplistic view of the quality of science and how it affects your paper being accepted. But within this, there are other considerations. Now, I just want to focus on one thing, and that's a clinical question. It's a shortcut which reviewers and editors use to assess whether your quality of the science of your paper is good or not. Because if you don't have a clinical question, it's very, very likely, over 90% certain, that this paper will have poor science. Now, what I mean by a clinical question is, do you have a hypothesis? Do you have a question at the end of your introduction or at the end of your objective section that says exactly what you're trying to do in the study? And if you don't, very often you will end up saying something like, we are trying to report our experience in something, something, something. Whenever a reviewer sees the 2 words, our experience, they automatically know that this author has no clue what he's trying to write about, and it's going to end up a very poor paper. Because when you're trying to report our experience, you don't know what you're looking for, you don't have a focus for your methodology or your study design, and you're going to end up just trawling through your results, trying to find P is less than 0.05. And you end up doing something called data trawling or P hacking, and I'll show an example in a minute. So this is an example of our experience. So you look at that title and you see experience of a single institution, and unfortunately a lot of experienced reviewers will see that, and even that title alone they're automatically going to reject. If you look at the objectives line, it's just one sentence, and all they say is we present the experience of blah blah blah. They're not actually looking for anything, and already 99% of reviewers will say forget it, I'm not going to read any further. Now if you do a paper like this, the results are going to be all over the place. There's nothing in focus, and they end up with conclusions that really mean nothing. So in this particular paper, I'm not trying to be too critical, but they say we recommend doing a CT. But if you look at the results, there's nothing about CT in the results because they didn't know what they were looking for, they didn't find any specific results, and they make a conclusion that you could have just read out of any textbook. So this is an example of an easy to spot bad paper. But they're not always so easy to spot. For example, here's a paper, it's a meta-analysis on non-intubated VATS. And you think, wow, top of the pyramid. But again, because the authors, look at that title, it's very non-specific. They don't know what they're looking for. So they end up with results like this. And they do a lot of P calculations, and they found one result where P is less than 0.05, and they submit this paper and hope it gets published. But that result refers to chest strain duration. How does chest strain duration have anything to do with intubation or non-intubation of a patient? It has nothing to do with it. And it's just fortuitous that they found P is less than 0.01. And this is just an example of what we call data trawling. They're doing a lot of data analyses trying to find P is less than 0.05. It's bad science. Here's another example, another meta-analysis. So again, you see all these different calculations in this meta-analysis, and they're trying to find subgroups of patients where they might find P is less than 0.05. And they found it. But by doing all these crazy subgroup analysis, trying to find a number, this is what we call P hacking. You're just trying to do a lot of crazy analysis until you finally, eventually, have P is less than 0.05. And again, experienced reviewers spot this instantly. They know that there's no focus to this paper. It's just a spurious result, and these papers tend to get rejected. So that's quality of science. In terms of quality of writing, again, we could talk all day about this, but let's make things short. Reviewers, remember this thing, reviewers are lazy. They love low-hanging fruit, i.e. common mistakes, because it's easy for them to spot. And if they can find enough common mistakes in your paper, they're going to fill up their basket and they say, okay, that's me for today. I have enough to reject your paper. So don't make these common mistakes. So what are we talking about? In the introduction, no clinical question. We've already talked about that. In the methods section is if you don't properly describe your inclusion and exclusion criteria for selecting patients for the study so that they don't even know who you've put into this paper. If you haven't accounted for whether or not you've done any bias reduction, if you haven't defined your outcome measures or use appropriate outcome measures, these are all easy things to criticize. Results section, usually not so many mistakes. But the big thing that a lot of reviewers look for are if you displayed the results clearly. Reading through a lot of text in the results is very difficult to read and very boring. If you can use tables, graphs, figures, these help the reviewers, and it will also eventually help the readers understand your message. So this is what they're looking for. You need to do data analysis, but not data interpretation. Don't speculate in the results section, but certainly do the proper data analysis of statistics here. The discussion, the most common mistake we find is that you're not actually discussing your results. Instead, a lot of inexperienced authors are simply reviewing the literature. It's not interesting for you to say, oh, author A found this, author B found that. That's not relevant to your study. A proper discussion is where you say, here are my results. Some other people have studied something similar, and this is what they found. This is how our results are similar or different, and why they're similar or different. And why do these differences make any impact on the reader? That's a proper discussion. Now, one other very common mistake of inexperienced authors is that they use the discussion to boast about themselves. So you see things like, oh, they're naming techniques or an operation after themselves. They say, I'm the first in the world to do this operation. Oh, I'm superior. This technique is the best in the world. It's better than anything else. Or my results are better because I'm superior. Now imagine if somebody you hate wrote this. You would feel very unpleasant. Nobody wants to read this. So same thing. If you write something like this and you boast too much, the reviewers are likely to give you an unfavorable recommendation. Here's an example. Read the sentence. This is an actual paper where we rejected. The speed of the procedure was accelerated quickly due to the excellent clinical skills of the surgeons involved. That's crazy. How can anybody write this in a scientific paper? And not surprisingly, reviewers hated it. This paper got rejected. So that's very quickly quality. In terms of message, I think most of you will probably realize that you need to have an impactful message. If you say something that will change the practice of colleagues around the world, this is an important message. Also, you want originality, timeliness, and transferability. Let me just explain each of these. Originality, everybody mistakes originality for rarity. It isn't. Rarity is not interesting. And every time we see rare in the title of the paper or somewhere in the abstract, this paper doesn't get accepted by the big journals. It goes to these relatively obscure open access journals. And the reason rarity isn't interesting is because if it's so rare that nobody's ever seen it before, the chances are that you will find this situation in your future daily practice is close to zero. So this message has no impact for most readers if it's that rare. Common things are things that we see every day, and if you can find something significant about a common disease, a common operation, that is interesting. In terms of timeliness, what I mean is this. If you've already bought an iPhone 10 or iPhone 12, nobody's going to buy an iPhone 4 anymore, right? It's the same thing in surgery. In any given topic in surgery, if you've already gone past a certain stage of the evidence and you're trying to still publish the paper in an earlier stage of evidence, it's not going to get accepted. Let's take, for example, vasolectomy. We've been doing this for over 25 years. And already we're moved to the stage when people have published meta-analyses, big data analyses. So in this day and age, if you're still trying to publish a retrospective case series, forget it. Nobody's interested. It's old news. We've moved on. So what about a newer topic like uniportal VATs? Well, thanks to our good friend Dr. Diego Gonzalez-Rivas, things like case reports and case series are already we're well past that for uniportal VATs. So don't even try submitting this. It's not going to get published these days. In this particular topic, we've already moved on to good case control comparisons, measuring objective benefits, etc., etc. So this is an awareness of timeliness will help your paper get published. Know where you are. Now, I also talked about transferability, and I'm using this example. This is a paper we rejected recently. It's a very good study, actually, looking at fungal disease in Chinese lung transplant recipients. A very thorough study, very well done. But the problem is, you look at this paper, it's about patients in southern China, and that's it. How is this relevant to any patient in Egypt? It isn't. It's got no relevance. It's not transferable as a message. And therefore, if you're going to publish a paper like this, you've got to write your paper in such a way that you have a message that will be relevant to readers around the world. And unfortunately, the authors haven't done that in this paper. So very quickly, I want to move on to intangibles. So intangibles, we're talking about things like legal, social, and ethical issues. So if you have major ethical issues or legal issues, obviously the journal's not publishing it. But we also, as editors, think about whether your paper is bringing any benefit to the journal. Yes, we're very selfish. We're looking at fun factors, and we're looking at whether the paper is topical. And let me illustrate what I mean. So this is a paper that was accepted and in the Lancet Oncology, a very prestigious journal, a few years ago. Some of you might know this. It's a very famous paper, caused a lot of attention a few years ago, because it said that SBRT was better than lobectomy for stage 1 lung cancer. Wow, that's shocking. If this paper was true, all of us as surgeons would be out of a job. But it turned out that this paper was terribly flawed. There were many, many problems with this paper, and the quality of the science was quite poor. So how did this paper get published? Well, I'm very cynical, and one way to think about it is the editors at Lancet Oncology probably knew there were problems in this paper. But because it was so guaranteed to generate controversy and discussion, and therefore citations, that this paper actually boosted the impact factor of even Lancet Oncology in 2015. So that's what I mean, that sometimes journals can be a little bit sneaky. They're probably looking for their own benefit sometimes when they accept the paper. Now, I also talked about fun factor. Here's an example that you might relate to. This is a paper I accepted for publication in ICVTS a few years ago. So a bunch of Polish surgeons were having a nice holiday in Egypt. They took this picture and they said, wow, that's the first ever illustration in history of pectus excavatum. Now, of course, this is a joke. It's got no science whatsoever. But sometimes, every now and then, you publish a paper because it's funny. And this paper actually got a lot of good feedback for our journal back then. Now, in terms of topicality, is it topical? Here's a paper I accepted for the ICVTS in 2018. Now, it's just about penetrating war injuries to the chest. And you might think, oh, who cares? Everybody has penetrating war injuries in their practice. But this paper was published from Damascus, Syria in 2018. And in 2018, the thing that was on the news all around the world was the civil war in Syria. So when you have a paper on war injuries in 2018 in Syria, people paid attention. So this paper actually got a lot of good reviews and a lot of good feedback from our readers. So switch forward to 2021. And what's the most topical issue today? Well, obviously it's COVID. So what has COVID done to submissions to the major journals? So this is one of the journals that I work for, the Asian Annals. And you can see 2020, there's a sudden jump in the number of submissions to this journal, especially in spring and summer of last year when COVID was really boosting. And you can imagine a lot of people trying to submit papers. So you had a lot of COVID papers, and you also had a lot of papers that, well, people can't work anymore, so they just sit at home, write the papers, and submit it. This is true in other journals as well. Here's another journal. And again, if you're looking at the results from 2020, you see a sudden spike in the submissions to these journals. It's not just these two I showed you, but many other journals had exactly the same thing. Now, we, as journals, we receive all these submissions. Do these papers actually get accepted? If you're submitting COVID papers, are they accepted more readily? And the answer is no, they aren't. And you can see last year, as we get more submissions, the acceptance rate as a percentage is still dropping. So as editors and reviewers, we haven't actually changed our policies at all when considering what papers to accept or reject. It's actually stayed the same. We're still looking at things like what I just showed you just now, the evidence pyramid. So let's take an example of some COVID papers that we accepted and rejected. So this is a paper we accepted in the Asian Annals. And this paper was actually the #2 most read, most downloaded paper in the journal for the entire year of 2020. And you can see that it's actually a consensus statement from the Asian Society. It's right at the top of the pyramid. So the same rules applied. If you're top of the pyramid, papers are going to get citations, journals are going to love it. At the other end, here's a paper I just rejected just last week, the last COVID paper I rejected. And you can see here, this is at the bottom of the pyramid. It's a case report. It's a tracheal stenosis that happened to be in a COVID patient. But it really didn't show anything. And look at that last sentence. They said, in our experience, postoperative pathological findings and outcomes suggest that tracheal stenosis does not present specific features, blah, blah, blah. But this is just one case. And they're trying to over-exaggerate their conclusion when they only have done this operation in just one patient. And it's obviously quite weak science. It will never get citations. And this is just an easy rejection. So the same considerations still apply whether or not we are in the middle of a pandemic. And so the take-home message is just this. Nothing's changed. If you want to get your paper published sometime this year, pay attention to these things. Quality, the message you're trying to convey, and some intangible factors. Thank you very much.
Thank you, Dr. Allen, so much. I have to thank you twice. First one for I sent you last night that we need this topic, and it's a very short notice. And surprisingly, the presentation was fantastic. I love it so much.
Thank you so much.
Mind all the attendees and audience that they can send their questions, and we will try to answer all the questions that comes to us. So Dr. Allen, you will be on the next talk again?
Yep, on a video.